Hey everyone, it's Dr. Rick, founder of Herbal 411, and today's tutorial is going to be on the team approach to health and healing. To me, there's two big things that you have to be targeting if you're going to be on the road to healing and or being healthy. One is a healthy lifespan, meaning you go from birth until death and you try to decrease the amount of diseases or symptoms that you end up having and or not having. So there's healthy lifespan, and then there's longevity, meaning that we try to extend that length of time that you're alive and healthy to as far as we can into the hundreds. Now, if you can't get to 100, 90 would be nice, but what would 90, 80, 70 be if you're in a wheelchair, you can't move, or you can't remember anything, or you can't eat anything? And that's not fun. I think a lot of us will depend on our medical insurance to keep us healthy. And I got news for you, it doesn't keep you healthy. You would figure with paying a mortgage every month, if you do pay for your own health insurance, that you would get all the carte blanche ideas and access to getting healthy or maintaining health, but you don't. It's not that way. Medical insurance nowadays is for catastrophe, and I think that's always fair, whether you have an accident or something that is unforeseen. But the idea, again, going back to that team approach, is if you can't see it, then that's fair that you just have to deal with it when it occurs. Again, medical insurance. But if you put a proper team together, they hopefully will be able to see it in what and how you're living. So I think let's start from the top down. I think you should have a team captain, and I'd like to be that captain. Now, there's other people, depending on where you enter, whether it's you have the diseases and symptoms at birth, or you have it in midlife, or you have it as you get older, or as you're really old. There's other team captains that can also take the helm. But I believe my practice, I'm a medical doctor, and I have practiced or studied in family medicine, sports medicine, non-surgical, and also integrative medicine, in addition to being a hiking guide in national parks, practicing martial arts, and also a yoga teacher, and a certified traditional Chinese medicine acupuncturist. So all this stuff is really fun, and I've sought it out because my curiosity and my journey just brought me to all these things. But I think altogether it makes me, I guess the poison is, when I see somebody that's suffering, or when people come to me, I really got to pry apart everything. And some people will know that when I give homework, which is what you get after your consult with me or your meeting with me, that's a really long narrative that most people get. But I give A, B, C, D, or 1, 2, 3, 4, and these are your steps that you have to do before our next meeting. Because you do need a coach. There's a lot of information out there. If you've been trained in healthcare, then great. But honestly, look at some of your doctors, and some of your doctors are looking really unhealthy and or totally stressed out or burned out. And that's a different tutorial, but if you try to be healthy on your own, most people will usually go back to what they learned when they were kids. And that's usually don't eat and exercise your head off. But that doesn't always work, and when you have a family to raise and or a business to run, or you have to work for somebody, there might not be that much time. So let's just face it, we do have to make a living in addition to finding your calling. But my calling is to try to give you guys the foothold that you need to propel yourself into a healthier lifestyle. So, team captain, just to give you good guidance and also help orchestrate the other members of your team. And it pretty much boils down to 3. One member I find that's really crucial after I evaluate you is the nutrition coach. Now, I can do very big movements as far as choose keto because your blood data says you benefit from it, or choose vegan because of the data from before that can be applied to you and your disease process or your age, or choose fasting, or choose Mediterranean. Doesn't matter. I think that I've sifted through enough data in the last, I calculated, I think I'm in the, if you're going to put it in grade experience, I'm in like the 26th grade with all the fellowships I've done and training. So you need a nutritionist because I can do the big sweeping movements, but sometimes you need a plate-to-plate coach to tell you what you should be doing when you go shopping, how to eat your food properly, and that's very valuable. What mixture would help with your disease process, or if you have irritable bowel syndrome, or if you have inflammation in the joint. There are certain things that are black and white that in the data and in the research, but there's certain things that are nuanced that are very confusing. There's a lot of data out there, NIH, PubMed, Google Scholar, they have all the studies that you can review, but honestly, there's some really good reviews and there's some really crappy reviews. You can find any study pretty much to support your cause. The question is, are you on the right journey? And that's what, again, so you need a nutrition coach. You also need a movement coach. And I know a lot of you will say, I can exercise on my own. Fine. I will tell you this. A lot of my guys that participate in resistance exercise, that means building muscle, a lot of my guys, they're not doing the right thing, and I find that they have metabolic syndrome. They look great and they look buff, but they have metabolic syndrome. That's the first step into diabetes, high cholesterol. It's called diabesity. High cholesterol, elevated glucose, insulin resistant, high blood pressure. You die in a casket, and they have to make a casket like a V because you're huge, but that's wrong. And again, you won't die suddenly, you'll die slow. So I also have the opposite, where I have a lot of cardio guys, ultra marathoners, and their numbers are great, but they actually, they're off balance. They have either too much wear and tear to their ankles, their hips, their knees, arthritis is there, it's time for a knee replacement or a steroid shot. I really honor both sides, the cardiovascular guys and the resistance guys, but I think that gals too. I think that you have to practice both. My hikers too, my yoga practitioners. I think there always should be balance, and that's why I think the team approach is the best way. So you need a movement coach. If you want to try it on your own, fair. This costs money, I understand, but you might be able to use a physical therapist, if they're good and if they take time, a physical therapist to look over you versus a personal trainer versus a chiropractor that's in the gym with you. I have a couple. But the bottom line is that you have to have some kind of guidance as far as, okay, where are we going down? What kind of activities do we do? Even if it's a group that you participate in. Sometimes if you follow the group mentality, that's good. It'll push you forward, motivate you because you're in a group. But you have to have a personalized approach to have this formula made for you, because another person's formula might not be yours. So movement coach. Finally, a stress coach. It's not that we can really reduce stress. Nobody can control their external environment. Stress can be interpreted as financial stress, weather or climate stress, family stress, unemployment stress. There's a whole bunch of different stressors, or genetics from before that might be putting you into a little depression at a certain age, or just the fact that you're overweight, you can't move, you're in pain, and that's depressing too. So sometimes to break out of that, you need to be on medicines, just like any disease process, whether it's a nutritional deficiency, an obesity issue, or arthritic issue, or a mobilization problem, or you're paralyzed with fear, or you're stuck in your bed because you're depressed. There's always going to be something that you can be sprinkled with, the fairy dust to be sprinkled with to make you better. And then sometimes it's just one step at a time. And you don't have to get all the coaches, but I do believe that the highest success is going to be in those three fields. There is another pillar that I like, and that's using wake and sleep cycles properly, or day and night properly. And it might sound very nuanced, but I think that's now something of a disease process to understand and comprehend and fix, because most of us are doing what we can as far as work, but we're on screens all the time, and that's really upsetting everybody's deep sleep and REM. Deep sleep, think of it this way, tells the brain to heal itself. REM tells the musculoskeletal system to heal itself. I kind of just truncated that. And when you sleep like a teenager, great. But how many of you guys, 30, 40, 50, 60, 70, sleep like a teenager? I can tell you most of my 60-plus-year-olds are fragmented with their sleep at least 4 times a night. It's okay if you go back to sleep after you wake up, but that decreases your REM and your deep sleep amount per night, and that's going to lead you to either dementia and or a musculoskeletal problem. And we're going back to square one, where you have to have all these shells, all these mobiles balanced properly so that the baby mobile will be balanced over the crib and it'll rotate in a nice way. Again, that's what a team captain is for, to kind of send you here and there. Also to know the community that you live in and who's good and who's not good. I think that if you look into functional medicine, which I've seen a lot of patients do, because patients are getting smart and they're taking their care into their own hands. And if you have even a little bit of a nugget of success, bringing that information to your doctor and saying, hey doc, I was able to lower my weight and lower my glucose, see? A doctor probably doesn't have time to enjoy that and say, yay. Doctor will probably write you a lower prescription for whatever they're going to be weaned off of, if they have time. And we can't blame the medical community. It's now run by insurance, and doctors are getting way too burned out. But I think most of us healers, and the other providers, healthcare providers, chiropractors, nurse practitioners, acupuncturists, I think we're all got into this field to help other people, but it's just become too much of a business. So you have to really be careful. If your doctor doesn't even want to listen to you, I had a patient that said she timed the endocrinologist and the guy came in and left. And I thought he was a good doc. Not anymore. I'm not referring anybody to that guy. So 11 minutes only. What can you fit in 11 minutes? I think people poop longer than that. So anyway, it's all screwed up. But don't take your health care into your hands by yourself. Get a team. If you're not from Illinois, I mean, you can consult me. I'll give you my address, because I do virtuals or I do coaching locally in Illinois. I have a couple patients from outside the U.S. too. So you can probably find somebody near you. I would always look towards graduates of the Dr. Andrew Weil Integrative Medicine Fellowship. I think that's an excellent fellowship. And or just see how your doctor looks, maybe. Well, I guess we can't use looks because we don't know where they are in their journey of their own health. But see if they're open to suggestions. Bring questions beforehand. I think it's fair to ask questions. Sometimes in Western medicine, docs are only allowed 15 minutes because I'm not an employee anymore, but when I was an employee, I had to honor the place that you're working for because they pay you huge bucks. And I decided that I don't want to be a prostitute in that sense, so I signed off, and I'm not working for large institutions anymore. Well, I'm going to, but more in the urgent care center and just to make ends meet. However, I will never give up on my practice here because I love helping people, and it's really exciting when I have people graduate from my care. So hopefully this gives you a couple of ideas. If you're on your journey and you have had success, put down in the comment section how you did it. If you haven't, consider me or another integrative medicine doctor and just keep your health as your medicine and keep on moving forward. Thanks for watching.